Hello, my name is JT Yarter, and I'm a second-year medical student at the University of Washington in Spokane, here to tell you about my RUOP project this summer. I participated in the medical humanities track for my project, which involved collecting an oral history of the pandemic from various healthcare workers in the community of Moses Lake, Washington. Just to give you a little background of this community, Moses Lake is located in an agriculturally focused region on the I-90 freeway and is the largest city in Grant County. Because of its size relative to the surrounding towns, Moses Lake is also home to manufacturing and healthcare industries that serve the surrounding region. As a part of this project, I attended 5 Zoom training sessions throughout my RUOP experience, where I discussed the background, methodology, and ethical considerations relating to an oral history, with other students completing the same RUOP track across the WAMI region. An oral history is different from a traditional interview in that instead of seeking the answers to questions, it focuses on eliciting stories and experiences from the person being interviewed. The purpose of this project was to collect and document experiences of the pandemic from the viewpoint of supporting staff healthcare workers whose voices can often be silenced as the media focuses on the stories of doctors and nurses. To accomplish this goal, I recruited 5 different healthcare workers in the family medicine department of Confluence Health in Moses Lake. Volunteers were given the option of in-person or remote interviews that were collected via audio or video recording. The interviews averaged about 30 minutes in length, and the workers interviewed included 3 medical assistants, 1 receptionist, and 1 environmental services worker. Following each interview, the video or audio recording was transcribed into text and analyzed for general themes that ran throughout the interview. Also, recordings from each interview were added to the National Humanities Center archive and will be stored and used for future educational programs and possibly for a documentary about the pandemic. Common themes that came up during these interviews included healthcare role changes, where workers were asked to do more or take on different roles in the clinic as a result of the pandemic. Community response was also discussed, which was generally perceived to be poor in that the masking and adherence to public health guidelines early on in the pandemic was not followed. This is now transferred over to the vaccine effort, as several of those interviewed also discussed their concerns with vaccine resistance and misinformation. This topic clearly brought on the most distress from those that discussed it, as vaccines, which were supposed to bring an end to the pandemic, have only divided the community further. It is also interesting to note that a couple of those interviewed declined to comment on vaccines despite being vaccinated themselves, hinting at a fear of backlash either from employees or the community for their personal views on the situation. This theme of vaccine hesitancy correlates with one of the lowest county vaccination rates in the state of Washington in Grant County, where Moses Lake is located. Another theme discussed was the difficulty essential healthcare workers faced with their own children's education. While many others were able to stay home and help their kid navigate an online education, essential healthcare workers were not able to do so and felt that their kids fell behind as a result. The last topic discussed was how the community perception of healthcare workers changed. This topic was mostly positive in that workers felt more appreciated for their work during the pandemic. Some highlights from these interviews can be heard via the QR code on my poster. One of the unexpected benefits of the project was that it gave interviewees an opportunity to reflect on their experience of the pandemic and explore thoughts and feelings they may hold unconsciously or may have suppressed. Moving forward, some applications from the findings in my project might be to use these experiences in the aid of the vaccination effort, or just to shed more light on the education gaps in children of essential care workers during the pandemic. Thank you for taking the time to listen to my presentation. I would also like to give a special thanks to Dr. Randall Bunch and the Family Medicine Department team at Confluence Health in Moses Lake for their help on this project. Thank you.